Hello, I'm Dr. Katz and welcome to Intimate Lens. This is part 3 in our series of video about genital hygiene, and today we will be speaking about looking and inspecting the vagina. An interesting topic. Let's check it out. Is there a need for a woman to inspect her genitals and her vagina? First off, if we needed to inspect the genitals and the vagina on a regular basis for whatever life's event that would have been, then the vagina would have been placed at a place that's accessible to our eyes, wouldn't it? You cannot inspect the vagina just by looking between your genital lips. The vagina is only visible through an open speculum. So definitely not something that we do on a regular basis at home because we feel like, which again explains that the vagina is not a part that needs to be inspected, except in cases, obviously, when there is medical reason for it, at which case you would go to a clinician anyway. On that note, I would encourage, whenever you have your routine gynecological examination, to have your clinician put a mirror between your legs and have you look inside. We made it a standard treatment routine when we see patients. So women will look inside and say, oh, that's all there is to it. Oh, I understand better now. Oh, I see, I thought this and that and the other. So we urge you to do that. It's going to be a quick thing, and you being educated will help you quite a bit. Now, I have a list over here of comments women make often when we show them the vagina. Beside what I quoted before, let me read from a list. And it goes in no particular order. Some women say, when we ask them, let's look, I cannot do this. Why not? Makes her too anxious. Well, obviously we have something to address, right? I'm very ugly down there. What is ugly? Just your anatomy. Again, that's a perception. That's not a physical thing. I am going to throw up. Goes with the above. It does not look right. Well, how do you know what looks right? Explain that to me. And the conversation continues from there. I was told to never touch or look there. Yes, a common statement. Too bad, but a common statement. Will it hurt? Looking? How can looking hurt? It may only hurt the mind who is worried. As I said before, why? Is that it? Yes, the woman who sees and says, oh my goodness, this is all there is to it. Fantastic. How cool. There is nothing much to it. I can now stop worrying about it. A common statement by women. Some women will say, where is my hymen? Well, if the speculum is wide open, there is no hymen. A hymen would be there blocking the way to a speculum. A hymen cannot be seen. A hymen could be felt. When we put a finger inside to do an examination, we can tell if there is a hymen, if the hymen is intact, and that's the only time we can really see a hymen. Unless you take a baby speculum and you open it mildly and then look inside, but that becomes a medical procedure. But just with a naked eye, you cannot see your hymen. It's an internal structure when it is present. Not all women have a hymen. Another expression women say with a smile, I was never able to do that before. I am so proud of myself for looking at my genitals. So it is really about what the mind and the worry and the anxiety and the false perception and the fear of pain and discomfort and something is wrong, all of those things, all of these factors can easily develop a whole anxiety in the woman's mind about just looking at her vagina. Yes. Genital anxiety is a big thing out there. And if you have that, all the way to even having vaginismus, meaning that genital anxiety goes all the way to disallowing you to have vaginal penetration, please, let's talk. Please seek treatment. There is no reason. The vagina is just a body part, and the genitals overall, and the vagina per se, just the body parts were built for that. They typically look the same. They typically look okay. There is nothing to worry about. Take ownership over your body. Take ownership over how you feel. Just because you never looked at it before doesn't mean to say something is wrong. Just because you never saw another vagina and you're worried about how you look doesn't mean to say you look wrong. So please, if you're one of those who cannot exclaim in happiness how happy you are that you saw that body part and now you can really own it and you can really know what it looks like, if you have any of the other worries we mentioned before, please seek treatment. Let's talk. Let's work on that so you can own your vagina in a happy way. Very important. Now let's talk about inspecting the genitals. We already said the vagina can only be seen through an open speculum. Inspecting the genitals. Typically speaking, a woman does not inspect. As we said before, if we needed to inspect, we would have had the vagina mounted on our forearm, on our thigh, where we could really look at it easily. But sometimes you may think you have an infection, sometimes you feel a pinch, sometimes you feel a bump, etc. So you may take a mirror and take a look and explore. If you have any questions, if you're in doubt, if you're not sure, if you would like to learn more whether you are normal or not down there, typically speaking, you probably are normal. But if you have any worries about it, please speak to your gynecological clinician and have them explain to you, take you through it, and reassure you all is well. Lastly, why don't you lay down, put a mirror between your legs, or hold it in a way that you can really look. Separate your genital lips, better if you place the mirror on a box or on a something, so you can use both hands to separate both genital lips, the right and the left, and take a look. Find your outer lips, find your inner lips, find the clitoris. Recognize it is north of the vagina, it is not inside the vagina. Take a look with the vestibule, which means that's the area that has the vaginal opening as well as the urethra right above it. No, you cannot look into the vagina unless you've had multiple children, at which case you can look a little bit into it. Multiple children vaginally, that is. And then you can see, of course, your anal opening, the anus. Take a look at you. That is a good inspection for learning purposes, as well as if you would like to inspect, if you feel any bumps or lumps or something like that, take a look to do the initial exploration just to make sure you do not have any sexually transmitted infection. Of course, you will need medical care to validate, to check, to maybe take biopsies, take a culture, but you can take a look already so you can even describe to your clinician what you feel that you see. So it's very healthy to take a mirror, take a look. These are my genitals. Okay, I got them. I know what they are. In case there are disruptions, take a look before you see your clinician. But if you're one of those who is compelled to constantly explore and look and check and what color it is and what color it is not, let's talk about vaginal anxiety. This is not a normal, healthy way of thinking. So take care of that. Don't be stuck with that. It will just grow worse and worse, and we would rather stop it as soon as possible. Hopefully we answered the question you had. Hopefully you learned something new. Please share. Many women are asking all these questions. Be sure you see parts 1 and 2 of this video series. Subscribe, like, let us know if you have any questions, and we'll see you next time.